Good morning. So we're going to be discussing a 9-year-old boy with transient weakness, facial droop, and slurred speech. So first, we're going to go through sort of how the patient came into the ER, how and what their pertinent medical history is, and then factoring all of this in, what could possibly be wrong, and then moving into what was the actual cause of the event that we're going to discuss, then go into a more formal differential diagnosis, followed by the treatment of that diagnosis and the goals with that treatment, and then finally our question and answer. So first, a 9-year-old male presented in the emergency department. His parents reported that they saw him have a droopy face and his speech was super slurred. And after the first doc that spoke with him, the patient said that his left arm and left leg felt numb during an episode that lasted around 2 minutes, which had this droopy face, slurred speech, left arm and left leg weakness and numbness. And then after those 2 minutes, the symptoms just completely went away. So after that, blood, liver, renal, and thyroid tests were done, and they were all normal. They all came back within normal ranges, as well as there were normal vital signs as well as normal development. Though one point to mention that may become important in a little bit is that the patient did appear pretty anxious in the emergency department. So I mentioned normal vital signs and a normal blood test for a 9-year-old, and these can look a lot differently depending on age, height, weight, sex, things like that. But I'm not going to read through every single figure here, but just so you can see sort of what those ranges are. So with vitals, we're talking about the heart rate, the respiratory rate, the blood pressure, and the internal temperature. And then a blood test looks at red blood cell counts, white blood cell counts, as well as blood proteins like hemoglobin and things. Counts of those should be within normal levels as well. And then the renal system looks at GFR and UA, and these are just sort of measuring how well the renal system is filtering the blood. And then thyroid tests are measuring TSH, FT4, T4, and T3. So some pertinent medical history that was obtained from the family after first going through sort of the event and the patient's vital signs is that this young man has a history of chronic gastrointestinal upset, specifically attributed to anxiety, and as well as he has had episodes of shaking in the arms and legs after hyperventilation, and those typically would occur when he was feeling some more intense emotion, or excitement. And they used to happen super, super frequently, multiple times a day, and it was diagnosed as stereotypy, though there weren't any diagnostic tests performed. That's where the doctors kind of landed on what the condition was. So given all of these things, what could be wrong? So like I mentioned, he had the drooping face, the slurred speech, and the hemiplegia. And these are very classic stroke symptoms. Though also he had this quick recovery from these symptoms, which was about 2 minutes, which is not impossible from stroke-like symptoms at all, or having what's sort of called a mini stroke, though it definitely is something to keep in mind that he did recover pretty quickly. And though still possible, a blood disease is less likely just because there were normal blood levels, but there are still possibilities of things like hypercoagulation or sickle cell anemia that could have caused these stroke symptoms. And because of the quick recovery, as well as some further tests done, it sort of is indicated that this is probably closer to the side of an ischemic attack rather than a hemorrhagic attack, excuse me. So just to keep that in mind, things that kind of could have caused that would be some internal trauma, an arterial dissection, which is kind of where the artery rips apart, moyamoya disease, cerebral arteritis, or vasculitis. And we can see in this diagram here, I don't know if I can get a pointer up or not, but basically there's some type of there's some blockage or something reducing blood flow in the vasculature to the brain, and that's causing some or all of these symptoms. So, yeah.
So, like we were saying earlier, because the patient did have stroke-like symptoms with the droopy face and slurred speech, and since his vital signs did come back all normal, the next option that the doctors provided was to order some head scans. The first head scan that they did was a CT angiograph, and CT angiographs are x-rays that used to visualize the blood flow in arterial vessels throughout the body. In his CT scan, it revealed that the focal severe stenosis towards the end of the right internal carotid artery and on the adjacent proximal A1 segment of the right arteriocerebral artery, and the right middle cerebral artery appeared to be severely narrowed and surrounded by prominent collateral vessels. As you can see where the arrow's at, that's where it's pointing to be the artery that is narrowed and around prominent collateral vessels. The CT scan, however, did show that there was no evidence of hemorrhage or acute infraction. The next two head scans was an MRA and an MRI. The MRA are used to help identify blood vessels and find abnormalities in these vessels. The MRI confirmed that the presence of the focal severe narrowing at the end of the right inferior cardiac artery, and also prominent collateral vessels and moya patterns. And as you can see, it's like a puff of smoke on the M1 segment, which is like the midline. I wish I could point it out, but just like smoke signals that are coming out. And the MRIs are used to create detailed imaging of an organ or tissue with magnetic fields. So this MRI again confirmed the absence of acute infraction and intracranial hemorrhage. So we know that out of these three head scans that the patient for sure does not have internal hemorrhage or acute infraction. However, they all show that there is stenosis and that there are collateral vessels in his brain so far. For the next scan, this one is called the post-arterial spin labeling, also known as PALS. PALS are used to assess cerebral blood flows without penetrating the body by magnetically labeling inflowing blood. And from his results, there was an asymmetrical increased signal intensity along the distal branches of the right middle cerebral artery. And potential causes of signals intensity include traumatic, infectious, autoimmune, inflammatory, neoplastic, neurological, and iatrogenic conditions. And from what we've learned from the patient's past history, he has had some neurological conditions that has been affecting him. So that could be one possible reason as to why there was increased signaling intensity. And the last head scan that they had was a conventional transformed cerebral angiograph. A cerebral angiograph uses a special dye and x-rays to see how blood flows through the brain. And in this scan, it was revealed that there was severe stenosis on the right M1 segment, mild tampering at the end of the right anterior carotid artery, and a robust right superficial temporal artery. So again, there was another scan that shows stenosis on the M1 segment, and the cardiac artery being affected. So out of all these head scans, we can determine that, you could go to the next slide. We could determine that the patient does have symptoms of an ischemic attack. And if we look into the picture, it kind of just gives you the diagram. And we ruled out all the possibilities on how to get the ischemic attack. The imaging revealed stenosis, blood vessels narrowing, and the terminus of the right carotid artery and the moya-moya patterns, which is the puff of smoke, leading to the diagnosis of moya-moya arteriopathy. Because the MRI ruled out the hemorrhagic stroke, and the CT cerebral angiograph, MRA, and the pulse confirmed stroke was arterial. An ischemic attack was caused most likely due to an untreated moya-moya disease. Since the patient does have these stroke-like symptoms, we can infer that the patient did have undiagnosed moya-moya disease, and because of that, the stroke was what caused him to have it. And then because earlier the patient was crying before the onset of the symptoms, crying can lead to hyperventilation, which is known to trigger for transient ischemic attacks in children with moya-moya arteriopathy.
So just kind of going over what exactly moya-moya arteriopathy is. It's a progressive disease, and it's chronic. So the patient will always have it. It's a narrowing of the arteries in the brain, and it can lead to strokes, ischemic strokes, hemorrhagic strokes, and seizure in moya disease, but there are treatments. In the picture on the right, you can see where exactly that narrowing is going to be for moya-moya arteriopathy. And it's a characteristic feature of moya-moya disease, as Jazmin stated, is that puff of smoke. It's the collateral circulation forming around the narrowing of the artery, and this narrowing is caused by muscular overgrowth in that in the artery. Okay, you can go to the next slide. So so where am I? Oh, did you go to goals in treatment, prevent concurrent? Can you go back one? So the treatment for moya-moya arteriopathy is to prevent symptoms and prevent concurrent strokes. So to prevent strokes, something that is really important to do is to reduce stressors that can lead to this hyperventilation, because that's what causes that vasoconstriction, or that's one of the onset causes for like an ischemic stroke, because it makes those blood vessels in the brain constrict whenever his station. And on the diagram on the left, you can kind of just see you can see the relationship between like just vasoconstriction and vasodilation and CO2 pressure, and and then on the other thing that can be done to prevent strokes is antiplatelet therapy, which decreases platelet cells, which are what form blood clots, and so that can stop like blockages or strokes from a blood clot, like blocking the blood vessel. So then to prevent seizures and headaches that could be related to moyamoya and arteriopathy is just administration of anti-epileptic agents, which is to treat electrochemical things that are going on in the brain whenever a seizure happens. So it controls seizures, and then abortive and prophylactic therapies can be used to prevent headaches. So abortive treatments are kind of used after the onset of a headache, and then prophylactic treatments are used for to prevent the headaches, and those can just be taken. So the last thing that is a goal for treating moyamoya arteriopathy is to ensure cerebral perfusion, which is just blood flow to the brain. We want to make sure that there's adequate blood flow to the brain. So one thing that we can do to improve the cerebral perfusion is to revascularize the brain, and this needs to be done through surgical intervention. But non-surgical interventions include just staying very hydrated and avoiding blood pressure lowering agents. So whenever he's admitted into the hospital, they do put an IV in him. That's pretty standard, but that helps to increase his cerebral perfusion. And then again, they avoided doing any blood pressure lowering agents. They didn't need to, but that's important to avoid because that can exacerbate the situation. Could you go up one?
Sorry, my computer's being really slow to move around in it.
Okay, there we go. So there's two ways you can revascularize this area in the brain, or you can do it directly, which is shown on the picture at the very top on the right. And this is whenever you put a blood vessel directly into the area that you're trying to revascularize, which in this case it would be that carotid artery. But because his artery is so small, it has a diameter of less than 1 millimeter. It's very unfavorable for serving for this direct vascularization. So instead they do an indirect revascularization where they put well-perfused tissue in this area that's where his carotid artery is narrowing, and over the course of a few months, new connections are made, and that allows for better blood flow in that area of the brain. And that's the picture. Yeah, that's the other picture. So in his pre and post-operative MRIs, if you compare them side by side, the pre is panel A and the post is panel B. In this area before, we've already seen from Jazmin's slide, the pre-MRA. And again, we can see this puff of smoke, and it's not very well vascularized. And on panel B, you can see that there's a better revascularization, or there's better connection between the blood vessels.
Thank you. Does anyone have any questions?
Well, I have a couple. So, nice job, interesting. First of all, this they use the Mikayla, please confirm for me that they use the superficial temporal artery and then drilled a hole in this boy's skull and then connected that to the carotid arborization and reperfused the tissue sort of on the back end there. Is that what they did?
So the right superficial temporal artery was super small, so
Oh.
they weren't able to use it. But they put the tissue over that area that allowed for the neoangio. I guess I'm not exactly sure what your question is.
I'm just trying to understand what they actually did. I wasn't completely following that what the procedure was. So the tissue that is fed by the superficial temporal artery. I mean, it's like your scalp and stuff right here. It's just the stuff on the outside of the skull. So I can imagine it was pretty small. The kid was only 9 years old. I've had students present moya moya before, and when they've done that, and that I think I talked to you about that before. They had shown this like intense surgery where they like replaced a vessel, but you're saying that didn't work here, and I don't really. When you say they placed the vascularized tissue over the area, how did that work? I just don't really understand what that is. What that means? Is there like a hole in this kid's skull or something, or wow? What does that mean?
Yes, there is a hole in his head. His brain is exposed, but I'm not a doctor, so I'm not entirely sure exactly how the mechanism works. I just know from what I read that they did an indirect revascularization, so they didn't connect any veins to other veins or arteries to other arteries to allow for better blood flow. They put tissue over that allowed for new growth of connections.
I see. Yeah, that angiogenesis. It's interesting, and how ultimately. So you showed some of those pictures. How did that? Did they say? So it seemed reasonably successful. Did they say how that compared to like direct revascularization?
There wasn't any comparison in the case study that we read, but I can find that information for you and get back to you later if you would like.
Did any of you, in reading about this, so there's like some stuff about moya moya that it's still kind of a mystery to me. I've not I don't understand why it's unilateral. Why is it only on one side of a patient? I know there are moya moya manifestations that can be bilateral, but it's not called moya moya at that point for some reason. It's some other thing. Why is it just on one side? Did you come across anything that talked about that?
I can take the mind. So I think that from what I understood was that it's unilateral because the stenosis of the carotid artery on that side leading to that reduces the growth of arteries all in the vasculature in the brain already. So you have those like tiny wispy puff of smoke sort of types of vasculature. And so when the stenosis on one side happens, it sort of forces it so that it can't grow all the way in the brain. So then it develops abnormally. And I don't totally know why that. I didn't come across why that can only be on one side, but the way that I understood it is that when stenosis happens on one side, it's like it's not going to cross back over to the other side of the brain.
Right. Yeah. Yeah. The vasculature. I mean, you do have collaterals along the circle of Henle or whatever it's called from the vertebral arteries in the posterior, but the carotids are separate. But I've never understood why it only affects one carotid, for example, and not both carotids in a person. There's other things about this disease that are mysterious to me, like it has this bimodal age distribution. It pretty much affects either preteens or teenagers, and then people in their 40s. It mostly affects women. About 2/3, 3/4 of the cases are women. It only, it's affects people of Japanese descent much more. It's interesting. Okay, are there any other questions?
Yeah, wait, so further vascularization, they basically, do they I'm kind of, I guess, confused as how that works. Do they cut out the small flap of the, that are covering over the brain, and then I guess I'm just confused as to how that works.
I'm not sure where the tissue came from. It just says in the reading that it was well-perfused extracranial tissue. So it was I assume it was some sort of a graft. I'm not sure, but then they just placed it over the area where there was poor vascularization, and it over time, whatever was, I'm not sure how the tissue did it, but it's amazing that it revascularized the area. It just formed new connections, new.
Yeah.
Yeah.
It seems like they simply removed part of the cranium and then sutured it back up, and that superficial, the scalp tissue there, the blood supply to that tissue then sent little capillaries down into the brain. But that this person,
Yeah, it almost looks like they took something out from underneath. I don't know.
Well, they would have had to have removed all the dura. The dura is gone.
Yeah.
The cranium is gone.
Okay, that's what I was thinking.
Yeah.
Okay, thank you.
They had to. This person obviously must have to probably wear a helmet now or something. I don't know. To protect.
That was one thing that he was told to avoid, sports that could lead to head trauma, and he had to wear a helmet if he was doing riding a bike or doing anything that he could hit his head.
Yeah. The brain is literally exposed now in this person. It's unfortunate that they couldn't get a direct vascularization, because often when they can do that, then you don't have to have the chunk of their cranium gone. It's an interesting treatment.
Thank you for clarifying.
Anyone else? Okay. Thank you. I appreciate it.